Today's vodcast is going to be covering therapeutic communication. We recommend that you read the chapter in your textbook on this material before you begin the podcast.
We have three objectives that we want to accomplish in this vodcast. One, we want you to be able to leave with being able to distinguish between therapeutic and social communication. We want you to be able to demonstrate the use of therapeutic communication techniques and be able to describe the effect of blocks of communication and identify at least three of these.
Therapeutic communication is the interaction between the nurse and the patient that focuses on the patient for some purpose. Social communication, on the other hand, is the sharing of personal information and intimacies between two persons who are equally involved and meet one another's needs, like in a family or with friends.
Some of the things that you'll use when you're communicating therapeutically is clarification, reflection, active listening, paraphrasing, restatement, silence, and open-ended questions. Some barriers to effective communication is giving common advice, minimizing the client's concerns or feelings, using jargon or cliches, being judgmental, interrupting, and closed-ended questions. Okay, to start with, we'd like to give a demonstration of inappropriate responses that can be barriers to therapeutic communication. In this scenario, we have Michael, who's a 50-year-old man who's in the hospital recovering from a myocardial infarction. He's been told that he is going to have to make significant changes in his lifestyle, including getting a less stressful job. He's feeling uncertain about his future.
Howdy, I'm Jerry. I'm going to be your nurse today. I was looking over your chart. Yeah, boy, your cardiac enzymes, they're off the chart. They're way up there. And it looks like you had quite a blow to your ticker, huh?
Yeah, if that's what you say.
Yeah. So, it looks like later on today they're going to do some more info. We'll get you a 12 lead and echocardiogram. But they're going to find out the same stuff. That basically you had a heart attack. And, well, we're going to try to make sure that you've got the knowledge and the strength and stuff to make sure you don't get another one. So tell me a little bit about your job.
Well, right now I'm working in business sector and I'm pretty busy.
Yeah.
6 days a week.
Oh, my God, 6 days a week.
Some days I work 12, 16-hour days.
Oh, my God. See, now that's what happens. You start working really hard. You start doing everything, and you get the stress. The stress comes right into the heart, and bang, it's gone. So you got to cut that out. Got to get a less stressful job. Something nice and relaxed and easy. Maybe sit around talking to folks like working at a Home Depot or something. How's your diet?
Well, again, with the stressful job, I try to eat well 2-3 days a week.
Mm-hmm.
It's about as much as I can get right now because of time.
Mm-hmm.
So I supplement with fast food.
Oh, fast food. Boy, there's the thing that you got to watch out for is that fast food. You got to stop that altogether. You'll have a dietitian come in and set up a whole diet for you. You'll get a lot more fruit, vegetables. You'll eat a lot better. And do you eat a lot of meat?
Well, I try to eat fish and, boneless, skinless chicken breast, but I do like steak as well.
Oh, yeah. Well, the fish, that's good. That's good. You can have that from time to time. Don't fry it. Skip the meat. Skip the red meat. Maybe on your birthday or something like that. But that's what I'd say. Lower the stress on your work there. Keep down the other the work. Make sure you get your diet in line. Do you have any other concerns or questions?
Well, right now my wife is really busy taking care of the kids.
Oh, yeah.
I want to know how much help will I need when I go home.
Well, that's a good question. Yeah, I don't think you'll need much. We'll try to get you set up to where you might need a little. She can sort of keep an eye on you, but you'll be fine. We'll get the dietitian will set you up. Everything will sort of fall right in place. It'll be all right. Yeah, you don't have to worry about that. Anyway, I've got about 4 other patients I got to take care of, and I've got another admission coming in later. Do you have any other questions or anything that you need to know?
No, I don't get it.
Okay, we'll be around.
So, Michael, how was that interaction with Nurse Jerry for you?
Interaction with Jerry was a little stressful. I do not believe it was a therapeutic
session, I learned more about Jerry than Jerry learned about me. And I felt shut down a number of times, which as a patient would have increased my anxiety and my stress level already being in an uncomfortable environment.
Can you think of anything in particular that he said or that he did that made you feel so uncomfortable?
The biggest things were cutting off my thoughts and my sentences and telling me how everything was going to be great, the positive spin on my condition. From my perspective, everything was not going to be great, and we did not explore, honestly, in my opinion, what my main concerns were. And Jerry also shared with me toward the end of how busy he was. So to me, that was a reflection of don't bother me. There was also use of jargon, terminology that I was not familiar with.
So a lot of false reassurances, jargon, and being preoccupied with my own schedule.
Yes, your own schedule, your own workload, the jargon.
Well, I was playing the role of somebody that was very busy, very preoccupied, like Michael spotted out, with myself, and just thinking that Michael was one more patient that I had to deal with, but not really paying attention to his needs.
Did you feel empathic or caring for him?
No, I did not. I was more concerned with getting through the day, telling him that he had to make changes, and I was deciding what those changes were going to be for him with diet and his work and exercise. And basically, I was making all the decisions. I wasn't asking for any input from him or what was important for him.
Now we will repeat the scenario with Sylvia using effective therapeutic communication.
Come in.
Hi, Mr. Hopkins.
Hello. Yes, I'm Michael.
Michael?
Yes, ma'am.
Hey, I'm Sylvia.
Hi, Sylvia.
How are you today?
I'm good, and you?
I'm doing well.
Great.
So I'm going to be working with you today and hopefully learn a little bit more about what's gone on with you.
Okay.
So you want to tell me what?
Well, yeah, I think this week I had a little chest pain, and came into the emergency room, and they said I had a heart attack. So that's a little bit new for me. I've never had a heart attack before. But my uncle and my father had heart attacks at about the same age as I did.
So you have a family history of heart disease?
Yes, ma'am. Yes, ma'am. Just the two people. So is that really a history with the two people?
Yeah. Yeah.
Okay.
So tell me, stressful? Have you been?
Yes, it's very stressful.
I'm going to pull up a chair here and sit
Oh,
down
sure,
for a
go right
sec.
ahead. It's affecting my home life a little bit also. My wife is recently unemployed, and she's at home with the kids, but she loves the kids, but it's stressful being there with them. Her work was her breakup from the day from the kids. Well, my wife, she identified with her job, and that was a part of her personality, and now she just feels like she's just a mom and not a mom and a professional. And I have to deal with that as well. I have to take over and take care of the kids. After I get home from a long day's work, I have to get dinner, give them a bath, and then put them to bed. And it's a lot of extra work and mental, emotional stress.
I'm having a little bit of a hard time understanding this altogether, so if you could help me out. Your wife is at home, and that's a new role for her.
Yes.
And so she's there during the day with the kids?
Yes, ma'am.
And you're coming home at night, and you're fixing meals and giving them baths, and that's new for you.
Yes, ma'am.
So between the two of you, there's been a shift.
Yeah, actually there has. Yes, ma'am.
Have you changed in terms of how you take care of yourself?
Well, yes, because I have an extra burden of work, and with the family, I can't go to the gym as much. I'm down to 1 or 2 days a week at the gym, maximum, and I can't eat like I want to.
What were you doing before at the gym?
Before the gym, I was doing a lot of cardio. I would do cardio 4 times a week, and I would do like weightlifting about twice a week on the same days. So I would go about 4 times a week in total. And it was pretty decent, but since that stopped, I've put on a few pounds, and my stress level's going up because I don't have that release.
So, and you said you're not eating like you used to.
Correct. Because my wife and I, we had more time. We used to prepare meals, 5 days a week, and we had more money, so we could buy more fruits, we could buy more vegetables. But now, fast food is cheaper.
So lots going on in your life right now, it sounds to me.
But now when I look at it, it's a lot, as you said.
Yeah, it is a lot. Where do you think we could start to help you with all this? What would be the thing that would help you the most right now?
Well, right now I would like to work on something for stress management. I think that will be a good place to start, and stress and nutrition.
What have you done in the past that's worked for you?
I used to do the gym a lot, but I really don't have the time to do the gym right now.
Okay.
So if we can come up with something else, that's a stress reliever.
Have you ever practiced any relaxation techniques?
No, I've never really had a big interest. The gym always worked for me, so I really never had
So
a
you
need.
like to do more physical kinds of things?
Yes, ma'am.
What about walking?
I've never really tried walking. I wouldn't be against it. But my concern is if I could do it with my family, that would be better because I wouldn't have to spend time away from them. So that could be a good alternative right now.
And so that's something that you could start right away because you could even walk here in the corridors at the hospital.
Oh, okay.
Okay.
Thank you very much.
All right, Mike. See you later.
All right. You have a good day, Sylvia.
Michael, now how did that feel when you worked with Sylvia?
Well, the scenario with Sylvia felt good. I felt comfortable. She was open and engaging. The first thing I noticed was Sylvia knocked on the door and waited for my response before she entered the room. So that made me feel comfortable there because it was as though she actually cared about what I wanted and what I felt. Sylvia asked open-ended questions that allowed me to respond and elaborate on my concerns. She also explored different avenues of concern that I had. When I stopped a thought or an idea, she explored a little further. She also summarized my thoughts to help me build a clear vision of what was occurring. Her body posture was open and relaxing. She actually took a seat next to me, which was very comforting to be at my level, if not lower, which made me feel real good.
So getting clarification of your statements and verifying and your feelings and content.
Yes, sir.
That's great. How did you feel being the nurse there?
I felt good about the interaction. You know, I felt really empathic and I cared about his situation, and I think it went well. I was able to determine what I think were the real issues for him. He elaborated on everything that was bothering him, responded to everything. I think, when I couldn't understand or I didn't understand, he, then helped me to figure it out. So I think it went really well. I think the difference in the two scenarios is that both people end up feeling better as a result of the interaction. So what you say and what you do with a patient can make a big difference. Yeah. So I think we'll end the vodcast here. Just to sum up, we want to say a few words.
Yeah, I think it's important to recognize the impact that you have on the patient when you're working with them, and to consider that every moment when you're with the patient is an opportunity for therapeutic communication.